The period of purple crying is a head trauma prevention program, and it focuses on teaching parents what's normal about infant crying and also the dangers of shaking. It teaches the parent that it is okay to feel frustrated, and it gives you a plan of what you can do. And the whole point behind the title, The Period of Purple Crying, is that it does come to an end. So the crying may peak at 4 or 5 weeks of age, but by 4 to 5 months of age, it's going to start decreasing. The crying will eventually come to an end, as frustrating as it is at the time. So we discussed that physical abuse, the highest rates happen to be our kids less than 1 that are so vulnerable, and it typically tends to be a child is crying, a caregiver is frustrated, which leads to shaking that child. We know that these kids have long-term health outcomes. About a third of these kids will do fine. A third of them may develop some sort of a disability, whether it's seizure disorder, hearing loss, vision loss, some sort of learning disability, and a third of those kids die. So these kids are going to require a long, extended lifetime of medical care. So for us as healthcare providers and as parents, we need to prevent that. And the best thing to do in that situation is, when you have a young baby, is to understand that crying is going to peak about 4 to 6 weeks of age, and these kids may cry up to even 6 hours a day and be a healthy infant. And knowing that you have a plan for when that's going to happen. Know that it's okay to be frustrated as a caregiver. You will not always be able to soothe your infant. That's not because you're a bad parent, and that's not because it's a bad baby. It's just because that child is crying. So have a plan. Take care of yourself. Put the baby in a crib or a safe place on their back, and walk away and give yourself a 5-10 minute break and go back and check on that baby. It is completely okay to feel frustrated. It's what we do with that frustration that makes the difference.